threshold metric? I'm going to click on it in the meantime.
Okay, sure. So what we are showing here are a set of metrics. Case threshold is one of them.
Okay.
So the first thing you see that location selector on the left-hand side, and you selected which province you'd like to view, or you the whole country. Indeed. So case threshold, this is referring to the total number of cases in a week, but compared to the population in a space. So it's total cases per week per 100,000 population. All right. And this allows you to compare risk between two districts, for example, or two provinces. And with this metric, we classify an area into three risk categories, into a low, medium, and a high risk category, but we also term them as a control, alert, and response in order to guide actions to be taken and to support planning. Now, how do we make this classification? If, for example, an area is experiencing less than 10 cases per week per 100,000 population, we classify that as control. An area goes on alert when they are between 10 and 30 cases per 100,000 population, and an area is considered to be in a high risk setting or in a response setting when there are more than 30 cases per 100,000 population. Okay. And we see that with the color scale, going from a blue to an orange in alert, and then to a bright pink in the response phase.
So the response phase, which is the high risk phase, I mean, specifically now, as we use the tool to gear up for the festive season, that would most likely come with an advisory for you to not travel to that province, or is it an advisory to take further precautions, to really hone in on those precautions?
I think it is both. Okay. We cannot, we have to understand that people have made plans already. Sometimes it is not possible to perhaps cancel those plans and remain at home. If it is possible to cancel them and remain at home and not travel to a more risky area, that would be advisable. Yeah. But if, however, that's not possible, then what this risk map shows you is perhaps to bring the message home as to how serious the risk is, to encourage one to decrease contacts, to be particularly careful around the elderly and those at risk, and to maintain social distancing, hygiene practices, and mask wearing.
Yeah, absolutely. So if we go back to the top of the homepage there under hospital admissions, so this tab takes us through hospital admissions at provincial level. Is this daily admissions and occupancy at hospitals?
Yes. Now, firstly, this is for only confirmed COVID-19 cases. That's the first thing. It's not about total admissions into a hospital. It's particularly COVID-19 confirmed cases that have been admitted. Now, on the one side, you see the number of new admissions to hospital on a daily basis. This tells you the kind of pressure that hospitals are seeing, and this trend in perhaps admissions increasing and changing over time. And then on the other hand, what we call current occupancy. How many COVID-19 patients are there occupying a bed in hospital in a province at any one point in time? And this helps you to compare the seriousness of the severity and the state of the hospitals compared to the first wave. We can see this now in July versus what we are observing now in December.
Yeah. You can see each of the graphs, they're all peaking in the sort of June, July, August period, and then it starts to come down in September again. I mean, Dr. Silal, is it notable that these, specifically the hospital admissions tab, that this is for provinces? I mean, is the hospital's admissions tab the best way to get some advice on how I should be managing whether I'm traveling around the country this festive season or not? I see the resurgence analysis as possibly a much more useful tab, just because the hospital's admissions tab is a provincial picture of a whole number of hospitals in one province.
Indeed, I think they work together. So the resurgence analysis does help you to see at a district level what might be occurring at the time in terms of cases. I think it's an important decision, though, or an important aspect to look at the hospital occupancy and admissions, because if one happens to fall sick, not just due to COVID, but also for other reasons, can you expect there to be a bed available for you in the hospital? Sometimes, as much as one would like to go to hospitals in a certain district, if a district hospital is full, one would go move to other hospitals within the province, especially in small provinces where districts are very close together. There's often movement, between hospitals. We are already hearing of hospitals being full. This has been cited in a few articles already to date, and so or certain wards being full, shall I say rather. So I think they have to be considered together.
Yeah, and in terms of the data being used for the analysis on the site, particularly the resurgence analysis, how are you collating that data, and how often is the site updated?
Okay, so the data comes directly from the NICD. So it is the very same data that is reported by the minister on a daily basis. So that's the first part. We do update this application quite often. We aim for a Monday, Wednesday, Friday schedule. So in fact, given that today is a public holiday, we made today's update late last night, so we'd have the most up-to-date information. So we aim for quite regularly, at least 3 times a week. If the situation changes where things are moving on a fast basis, make these updates more regularly.
Yeah, absolutely. And I'm sure government has its own modelling data that is available to it. But is the aim of Epidemic Explorer for government modelling to also look at this website and to see how you're collating the data here?
Indeed. In fact, what we are displaying in the Epidemic Explorer open access version is just a subset of the analysis we have already provided to government.
Okay.
We're showing just 1 or 2 metrics to the public, but we've done a series of analyses and a variety of metrics to support planning around the country.
Yeah. Well, thank you very much for your time. Dr. Sheetal Silal is Director of Modelling and Simulation Hub Africa at UCT. Head on over to this website. If you are traveling this festive season around the province, it's a great way of taking a look at your own province and the infection rates around the province and the hospital admissions in particular. You can get an update on that, in fact, on a daily basis. The website is sacmcepidemicexplorer.co.za. That's all one word there, SACMC Epidemic Explorer.